Greetings, greetings. It is Dr. Robin Saleh, your very own licensed board certified functional healthcare practitioner and nutrition professional. I have 12 years of clinical experience in the area of acute and chronic inflammation. We do not plan to treat, cure, or prevent any type of degenerative disease, illness, or ailment. Please consult with your healthcare practitioner before integrating these educational tools and dietary tips. We are going to talk about pain and what are some of the natural remedies or natural modalities that we can inherit to help foster healthy pain relief through natural means. And a lot of people do not understand that if you want to get the right type of pain relief, you must be under the supervision of a professional on the right type of protocol. And you find a lot of people do not get the pain relief, and that is because you simply don't have enough knowledge and how to target acute or chronic inflammation related or induced pain. Pain is the body's natural physiological response to trauma. And unfortunately, all pain is not created from a food nutritional deficiency. It is also created by intolerances, allergies, normal wear and tear, exercise-induced injury, and improper posture. Excessive work, sitting down, or having yourself hunched over like this will cause pain-related issues. Okay, sleeping improperly. I always tell people to sleep with a pillow in between your leg. Also, when you're laying down, you want to sleep with a pillow underneath your neck so that your neck can lay and fall into that pillow so that your spine can be in proper alignment. And so many of the back pain related issues that we see is improper alignment. And so some of the natural remedies that will be beneficial is chiropractic care. Number one, to help put your system and your spine back into alignment. But you have to make sure that you find someone that you can trust with the maneuvering and the mechanics of your body, because sometimes if you don't get the right professional, they can actually hurt you versus helping you. So always do your research, listen to the clients, listen to the testimonials in that practice to see what they're saying, and that is the first step to assessing the structure of the spine. And so when we talk about the food intolerances, yes, food will cause pain, whether it be an intolerance or allergy. And what you'll find is majority of the people that we see, the cause of one's back pain is sometimes arthritis, whether it be osteoarthritis or degenerative disc disease. Okay, and these are all diseases in the bones and the joints. Okay. Inflammation in the bones and joints, chronic inflammation, and narrowing of the disc joint. Okay? So, you say, well, Dr. Saleh, what in the world am I going to do? The average person that I meet, they go to Walmart or Jewel's and they go pack up the cabinet and the pantry and start taking pounds of turmeric because they read that online. They take pounds of omega-3 because they read that online. No. The first step to addressing your pain is to hire a professional to see what foods need to be eliminated, to see what foods need to be introduced to help foster a healthy anti-inflammation response. Okay, that's the first step. Now, when we talk about the pain, some of the type of medications that they prescribe for chronic pain is prednisone, okay, and corticosteroids. Write that down. Prednisone, corticosteroids, injection, or they may prescribe a pill form. depending on the severity of the injury. So long-term use of prednisone will cause a nutritional deficiency, and if you are getting the steroid injections in the tissue so frequently, it can also cause tissue damage. Okay? So whatever space that you're in, you're going to have to inherit a natural healthcare modality just to address the root. Okay? Now, some of the types of, natural holistic anti-inflammatories are full spectrum hemp, raw crude hemp, 50 milligrams, 1,000 milligrams of turmeric, 1,000 milligrams of fish oil, as well as oregano. And oregano has been linked to killing off the viral pathogen. Now, a lot of people are unaware. Did you know that some arthritis conditions has been linked to bacteria, a bug, a virus? So you must take an antiviral supplement to help kill off that bug, and that will help the inflammation from the infection, and some infections will offset some type of arthritis, infection-induced arthritis. So right now we're just getting to the root. Okay. White willow bark is one of the original apothecaries. It comes from the willow bark tree. That was the first form of aspirin that was ever invented. And so it is also a blood thinner. So if you are on blood thinners, you also want to check with your healthcare professional to make sure that your blood thinners aren't, interfering with your pharmaceutical drug use. Okay? Now, what you'll find is our body starts to change, I would say in our 30s. And so you're seeing more people in their 30s, 40s, 50s, 60s, and 70s with severe nutrient deficiencies in the bone and joints, okay? The human body needs 90 essential nutrients for that bone to harden, to stiffen. And if you are in the care of chiropractors, you must have your nutritional deficiencies resolved prior to going in that chiropractic office. Because if you're getting adjustments and getting in line, what's going to happen is you're going to be so fragile and brittle. And so sometimes what we see in chiropractic care, sometimes people get a break in the bone, or they tear a muscle because they are so fragile. They was not a good candidate. And so most chiropractors are not trained in nutrition. Some are, some aren't. So just make sure that you are doing things properly. Okay, so now that we understand some components and some facets of pain-induced issues, the same thing applies for the knees and the joints. And hyaluronic acid, some people like to get hyaluronic acid injections. Those are quite beneficial as well. So just understand that if you are on cortisosteroid or steroid injections, just be mindful that they may provide temporal relief, but you have to really get down to your lifestyle change so that these situations won't come back. Now, what will happen if you do not address back pain related issues, sciatica, degenerative disc disease? A lot of people will undergo joint replacements and hip replacements and knee replacements and artificial joints. They said in 2020 there were 1,650,000 artificial joint replacements, okay? All stemming from nutritional deficiency in the bone and joints. I hope that you found this information to be quite insightful as we dig a little bit deeper. All aboard the yellow school bus. I'm going to go in baby stages with you so that you can elevate higher. So the goal is you want to be smarter than your doctor, and you want to tell your doctor what's wrong with you, and they are going to help you put the pieces of the puzzle together. Thank you, and you have a great day.